Preventing medication errors. So whenever we're talking about preventing medication errors, there's multiple ways and things that could go wrong. So it's very important that you stay up to beat on the guidelines and restrictions. Things change all the time. I mean, look at 2020, we had the pandemic. Before that, other places are having floodings, hurricanes, tornadoes, multiple things happen, causes things to change. So stay up to beat with whatever the guidelines are. When you get in the program, they're going to explain more to you. When you get a job and you get out of the program and you go somewhere else, you're going to learn even more stuff. So chapter 9 is preventing medication errors in this textbook, and it is very important that you read it and understand it. This is a math class, so I'm just going to hit the highlights on it. This first question here, it says that blank estimates that when all steps of the medication administration process are taken into account, hospitalized patients are subject to an average of one medication error. So if you will go on into your textbook, you will see that the answer to this is the abbreviation. 1 second, let me get this on here. It's IOM. Stands for Institute of Medicine. So definitely read it. The next one says effects of medication errors. So there's many different effects that could happen. I mean, what increased length of time in a hospital? A medication error. Another one is that you send the patient home with some medication and due to lack of communication or misunderstanding or the wrong medicine, or they become allergic, they end up in the hospital. Increased costs on both ends for the hospital and for the patient. Patient disability, it can cause multiple things. I mean, if it doesn't kill them, it can cause them issues that it's lifelong issues. It can even lead to death. And determinant to nurse personal and professional status, confidence, and practice, because you are still human. So errors can affect you emotionally. Safe medication administration. So it states in there that licensed providers must have the authority within their state that they're working in order to prescribe the medication. Includes verbal orders, repeat and verify all verbal orders accurately. Just because you hear somebody don't mean you're really listening to them. So it's very important that you repeat, that there is a clear understanding exactly about what's been stated. Verify safety of the drug order by checking a reliable drug reference. So you don't want to go to a drug reference from 1963 and compare it to the drug reference of 2025, so you need to make sure that you pick the up to date. Everything changes. The practitioner who administers a drug shares liability for the injury, even if the medical order was correct. So, if you're the one administering the drug, you want to make sure that what is given to them is safe. You're the one talking to them, so you know if they're going to be allergic or if they've had a reaction to it before, and so on. Verbal orders, written or enter verbal or telephone. So basically, verbal orders is whatever has been stated needs to be documented, and you need to keep a clear record. Read back to the prescriber to ensure the order is clear. So you want to validate and clarify what you're working with. The order. Get confirmation that the order is correct. Verification is required by the Joint Commission, according to all the books that I've read so far in this field. There are 7 parts of a drug order. Patient's name, the date and time of the order when it's written, name of the drug name and dosage, amount of the drug, route that it's going to be administered, the frequency or administration schedule or time of the administration, and prescriber's name and licensure. And usually they put their signature or their initials. Correct notation, the correct abbreviations, acronyms, and symbols. This is very important, guys. Don't make up your own. Don't just write your own abbreviations. I know that nowadays most people text and they shorthand it, and they use their own little abbreviations. You cannot do that here. Do not use trailing zeros. And what I'm talking about is, so say I asked you to round to the nearest tenth, and let me make up a number. So say that we have 23.9, and I said 23.97, and I said round to the nearest tenth. So we look at the tenths, which is this 9, and look behind it and ask, is that number 5 or greater? And if you say yes, we add 1 to this 9. So when I do that, I get 24 because 9 becomes 10, bumping this one up. 0.0, well, that's a trailing zero. So in medication, we would not put that there. And the reason for that is that sometimes we get in a hurry and our decimal don't look like a decimal right there. 240 is much larger than 24. So no trailing zeros. Lack of a leading zero. What if you had 550, right? And if we divided that by 100, we was just solving for it, we ended up with this. We don't want the trailing zero, correct? But we don't want to leave off the zero in front of the decimal because, again, say that your notation is sloppy. That looks like a 5. A 5 is much larger than 0.5. So if there is not a whole number other than, if there's not a 1 or 2 and so on in front of that decimal, we put a 0. Your own abbreviations, no. Okay, no to your own abbreviations.